Hi, good day mga ka-CSA. I'm back, I'm Kathy. Last year, yung ginawa sa akin ni Doc na NASAL ALAR bunching na I'm so happy na after a year, eto, walang problema, wala akong naging as in fear na first time kong magpagawa. So I'm so happy. And now, I'm really excited. So, another treatment na gagawin ni Doc na mas maganda at pampaliit lalo ng ilong. So, don't go away. We'll be right back.
Good day, everyone. Welcome to the CSA Certified Skin Authority. I'm Dr. Contessa, your certified aesthetic physician here at the CSA Medical Aesthetics. Now, we have with us a follow-up, okay? She had done a procedure before, which is a so-called ALAR bunching. So, we need to do a so-called refinement procedure to, again, enhance the sides of the nose. So, mga ka-CSA, let us welcome again Miss Kathy.
Hello, good day.
Ayan. Alright. So, the last procedure we did kasi, the ALAR bunching, we made use of the spiral cog para mag-narrow yung both sides ng nose. And actually, right now, ina-assess ko siya. Meron namang noticeable na pagliit na dito compared doon sa before we have done that ALAR bunching. And okay pa yung nasal bridge, okay? Tapos yung sa tip niya, medyo ito, the columella, I can appreciate the columella kasi dati talagang hidden yung columella ni Kathy. So, actually we've done a procedure less than a year ago na, no? Okay, so mga ilang months na rin. Actually, when we do thread procedures, we can repeat procedures like 6 months after. Okay, may cases naman as early as 3 months. Case-to-case basis kasi to. Pero most of my patients, 1 year. Pero pwede na rin ng 6 months. Okay, so now, we will be doing a procedure na we still wanted to make the ALAR tissues smaller pa rin. Okay, ang goal pa rin natin, the female type of nose kasi, narrower, slimmer, slender nose. Tsaka yung dito sa gilid, mas narrow pa. Okay? So, the thing is, yung sa nostrils ni Kathy, na minimize, yung tissues niya dito, parang talagang bulky, malaman siya. And then, pag nag-i-smile pa raw si Kathy, meron pa ring flaring, right? Okay, so, cases like this, we can do a procedure again to refine or to further make it smaller or narrower. No, Kathy. Kamusta ka naman nung after nung ating procedure dati?
Doc, thank you. I'm so happy.
Yeah.
As in, actually, lumiit talaga siya compared dun last year. So, yeah. Thank you, Doc. Yeah. As in, walang pain, walang allergy,
okay lang. Right,
wala. As in,
walang allergic reaction. Yes. Okay lang. Ang response lang or ang effect lang, lalong gumanda.
Correct. At mas gaganda pa.
And I think maraming naka-notice din sa'yo, di ba?
Yes.
Napansin nila na na-enhance yung looks mo. And actually, nag-contouring kasi tayo sa'yo dito. We did the nasal bridge projection.
Tsaka, Doc, ang laki talaga pinagbago.
Yeah. So, that's the thing eh. We're doing ito kasi in non-surgical procedures, mga ka-CSA. Of course, sa surgery, dun yung talagang mas big change. Yung altering looks talaga, tsaka sharper talaga. Pero tayo, non-surgical lang tayo. But somehow, it gave a big impact sa iyong yung personal or yung social life mo na most of your friends, I think, na-notice nila.
Yes.
Right? Oo. So, lalong maganda na, lalo pang gumanda. Okay. Yes. That's the thing that we wanted to do. Kahit non-surgical procedure, at least it had given a great improvement po. Okay? So, hindi tayo naghiwa, hindi tayo nag-cut. Medyo invasive ng konti, pero so far, wala naman akong nakitang naging scarring. Okay, that's a good thing. We wanted to avoid scars. Yung iba kasi concern sa scars or keloid. So, it was just an insertion of cannula threads. Okay lang. So, now ang procedure natin will be to further narrow. A technique I call tripod technique. So, I'll give insertion ng short cannula thread dito, PDO thread, tsaka dito. And then also in the, again, dito sa may midline or dito sa may cannula. I mean sa columella dito. So we'll do like a tripod, triangular shape ng kanyang tip of the nose. Okay? Para mag-project pa, para lumiit pa. And then, I will add lang dun sa ginawa kong bunching last time. Yung nag-insert ako ng kanyang spiral cog threads. Pero I'll be using N-fix thread right now. So, it's a different kind of thread. So, we start as usual, anesthesia. Okay? So, tip of the nose, anesthesia. Kanina, na-cleanse na po. And, nag-apply sila ng pampamanhid yung cream. Okay? So, as I've mentioned, mag-ALAR bunching pa rin ako. Repeat. For some cases kasi, I only do a one-time procedure. May mga ibang cases pagka like we monitor, I think after 6 months, after a year, kung kailangan pang in-narrow ng in-narrow, we need to do another procedure. Okay, case-to-case basis po. Kasi talagang hindi tayo pare-pareho ng nose anatomy. So, iba-iba po yung ating appearance ng nose. So, kay Kathy, kailangan pa nating i-boost yung pag-narrow ng kanyang nose. Okay? So, sa columella niya, lagyan din natin. Okay, this is just injection of a light. Okay? Okay, and then, as usual, we need a point of entry para sa ating mga cannula threads. Okay. I'll be enhancing a bit itong distal third ng kanyang nose. So, I'll be using a 40mm PDO thread. Like for example, I can use a Wyco 40mm. Yan po. Bleeder lang si Kathy ngayon. Just to have a narrowing of the tip. So this is just a 40mm. And then I can also use another short 30mm PDO thread para sa kanyang columella. But I need a point of entry. And sometimes po kasi talaga iba-iba yung technique. So I need the point of entry. Yan. So the needle I use for my entry point is a gauge 19 needle. You can use gauge 19 or gauge 18. So this is a 30mm PDO thread for the columella. Okay. So up to the nasal spine lang po. And so far so good. Now we wanted to do a tripod technique. So we wanted also to do it on the side of the nose. So we will continue with the injection of short PDO threads doon sa ALARs or sa sides ng nose sa pagbabalik ng CSA Certified Skin Authority. So we're back mga ka-CSA. So we are now showing the injection of the short PDO threads or short PCL threads for the ALAR area. Okay, we need to make a point of entry on the side. So entry point, and then I have a short, like a 30mm, 35mm PCL thread here, and then entry towards the ALAR left side. So I'll pinch the columella, this one here, the ALAR, the left ALAR here, and just have the full length of this thread to enter. So that's the short PCL. Okay, and then on the other side, okay, take note, it's really normal that we see bleeding, pinpoint bleeding. Whenever we do injection, there is an expected bleeding. Okay, kasi yung nose natin talaga is vascular. So I'll pinch this side here. And then towards the right alar. Okay. Exhale. She had a good lidocaine injection a while ago. Okay. And pull out. Now I'll proceed with an N-fix bunching. Okay. So we'll do puncture again here. OS please. So we're doing a multiple procedure for Kathy. Combination tripod technique and fix narrowing of the alars. Okay, so entry point. So I made a puncture a while ago here. So that's the entry point for my N-fix. So Kathy, you can breathe through your mouth. So can you turn to that side please so I can the small point of entry. Poker. I have to make it a bigger opening here. This is a gauge 19 cannula. And then do a through and through again. Through and through. Poker please for my exit point. Sponge. Okay, so this is the N-fix. To release and bunch. So whenever I use the N-fix, because it has a very good punching cuts on the strand of the thread itself, it holds much more stronger compared dun sa mga dating spiral cog. So I'll just cut. Okay. And this is it. Okay. So we'll just clean the area. Basically, that's the tripod technique that we use to narrow the sides of the nose. And then actually, I'll be adding a little bit of a Botox to make the tissues of the alars slimmer or smaller. Kasi talagang mabulge yung sa sides ng ilong ni Kathy. But the good thing is we were able to make it closer, and then we also have lifted again yung tip using the 40mm PDO threads, and we have inserted some of those short PDO PCL threads on the sides of the nose. Okay? So, I think we'll give a review sa pagbabalik ng CSA Certified Skin Authority. And we're back mga ka-CSA. So we have done a so-called tripod technique to narrow the tip of the nose. So we did injection of short threads, mga 40mm dito sa may dorsum and also dito sa may columella. So we made use of like a 30 to 40mm na mga PDO threads combined with PCL threads. And also on the sides, yung ating ALARs. So we also injected mga short 40mm, 30mm PDO and PCL threads for the ALAR of the nose para magmukha siyang, yun nga, that's why we call it tripod, or parang we want to make it triangular. Okay? Then we also made use of our N-fix thread na in-insert natin from one side of the ALAR groove to the opposite ALAR groove. And then we did a sort of punching effect para po mag-narrow. And then, meron lang noticeable na parang yung bulging, yung dito, sa may columella philtrum area. But that will be temporary. It will also go away. It will flatten. Okay? So, right now, we also add pang pinale. Yung ating final procedure will be to inject Botox dun sa ALAR tissue. Okay, both ALAR tissues. Ang goal natin is to further slim yung nagbo-bulge na laman dito sa kanyang sides of the nose. Okay? So, I have a botulinum toxin or Botox. Okay? I'll be injecting for the ALAR area. Well, with the Botox, we see result after 1 to 2 weeks. So, we will be injecting about 20 units of the Botox. Okay, 10 units on one side, 10 units on the other side. Okay? So, touching the ALAR area, injecting this Botox. Okay. I also do some aspiration to check if I'm okay. So, okay to push. So, I'm giving like about 10 units. Okay? So, actually, this procedure, medyo may discomfort to most of our patients kasi nga sensitive yung ating sides of the nose. So, yung kay Kathy, dahil naka-anesthesia pa siya, so numb na numb talaga. So, we can distribute yung 10 unit dose. Okay. So, sa kabila. So, again, the result of this one is like 1 to 2 weeks. Okay, so we're done with our Botox. Okay, and the goal is, this is a so-called refinement procedure or further narrowing of the nose, a repeat treatment for Kathy. Okay, for non-surgical po talaga, it's very important to have a check again, like you can come back after 6 months or after a year if you want to redo the procedure, or if you want to further enhance, or yung iba nga, to further lift pa yung kanilang tip of the nose. So, kailangan ng ng mga follow-up treatments din. So, after a year, pwede nating i-enhance pa ulit. So, pakita na natin kay Kathy yung kanyang result. Okay, so there's the mirror. Okay, tingnan na, Kath.
Oh my.
Yan. Sanay na si Kath.
Yes.
So, this is a repeat procedure na lang to further narrow pa po yung kanyang ALARs, to project the tip, and actually a little bit dun sa bridge area, nag-enhance tayo ng konti. And then, it's a procedure na gumawa tayo ng mga combination treatments. So, we have threads, yung mga different lengths of the threads, as well as the Botox. Okay? So, yung tripod technique, yung parang triangular nga po yung ginawa natin to make it narrower, slimmer, slender, a feminine type of the nose. Okay? So, yung dito sa kanyang bridge, okay, so andun pa rin yung slope. We wanted to retain a slope. Yung gusto natin dito is like a 130-degree nasofrontal angle, and this one is like a 110-degree nasolabial angle. And then, making it narrower, slimmer, so na bunch natin towards the center. In the future, I would recommend Kathy to do some filler on the sides of the nose. Kasi isang technique rin also to inject fillers dun sa ALAR groove para mag-lift yon and to push the ALARs toward the center. Okay, so, message ni Kathy.
Hi,
Anong
thank
masasabi
you,
mo?
Doc. Ayan na naman po. Nakita nyo. Lumiit at happy ako. Thank you, Doc.
You're welcome, Kathy. So far, so good. Okay lang. So again, this is a non-surgical procedure. Although it's still a so-called invasive procedure, it's minimally invasive because we made use of injections. We had some long cannula threads there. We even had short cannula threads, okay? And this kind of procedure should only be done by trained aesthetic physicians or our cosmetic surgeons. And it's not an easy one too, because we have to be very careful when we do the nose. The nose is very vascular. Marami ding blood vessels around the nose, so we should know what is the specific blood vessel supplying the nose. Medyo, ayan, may bleeding pa ng konti si Kathy, but so far so good po. Okay. Thank you, Kat.
Thank you, Doc.
So actually, meron pa po siyang follow-up with us, like a 2-week follow-up. And pwede natin ipakita sa kanila ano yung mga results after a week or after 2 weeks. Pwede pa nilang abangan, yung like ilang months from now, ano yung itsura. Kasi iba po curious, ano ba yung nangyayari within the first year. Kamusta naman? Okay lang ba yung produkto? Safe ba yan? Hindi ba yan nakakatakot? Or nabubulok ba yan? And well, this is the repeat procedure of Kathy already. So you've seen her in the previous episode when we did the ALAR bunching, and right now she's returning for a refinement procedure to further narrow the nose. Okay? So we guarantee you safety po, and when we do a procedure for you, actually we still do follow-ups. We check on you po. If you have any concerns, we actually accept all your messages to us. So mas na-appreciate namin when our patients still send messages po kung meron mga problems or concerns. Okay? Kaya napaka-importante, nasa doktor tayo. Magtungo lang po tayo dun sa mga certified doctors, aesthetic surgeons to do kinds of procedures like this po. Okay? So maraming salamat po sa inyong lahat. Kung meron po kayong katanungan, you may email us at csaskinclinic@yahoo.com. We have our FB page. We have a messenger there. It's the CSA Derm Centre. You can send also your queries. And our clinic is located here at the 2nd floor, Pure Gold, Dau Building, Dau MacArthur Highway, Mabalacat, Pampanga. Contact number 045-331-1117 or 0933-860-9193 and also 0917-504-4268. Yan, marami po kaming mga videos nasa aming YouTube channel lang po. Just type Contessa Salvador. And please click like na rin po and subscribe. Kayo po ang mga nag-aabang ng aming mga procedures. Ayan. So, meron doon kaming Instagram, doc_Contessa, and also, ano pa ba, yung FB ko, Contessa Salvador Alapag. Ayan po. Ayan, Kathy.
Thank you, Doc.
Oo nga. And I think yung mga sumunod din sa episode mo, natuwa sila ngayon kasi nakita nila yung naging result. Nung dati, na nagkaroon talaga din ng improvement. And ngayon, pwede pa rin i-enhance. Okay.
Plus, you're in good hands.
Yan, salamat. Okay. Yeah, kasi we always do a lot of conferences, conventions, hindi lang po sa ating bansa. So, we do it also outside the country. So, kailangan lagi po tayong updated kung ano po yung mga latest in the practice of aesthetic medicine, okay, internationally po. Yan. Siyempre po, we wanted to improve further our procedures, our services. Sana po we give satisfaction to all of you po. Yun lang naman. Right?
Thank you, Doc.
So, magkikita pa tayo sa
Yes.
follow-up mo. O, yan po mga ka-CSA. When it comes to natural beauty, you can trust the CSA Certified Skin Authority.